So we will now begin the speech pathology part of the Q&A session for everyone here that's interested in speech pathology. So we will just go through the questions that have been in the Q&A chat. They might have had some typed responses, but we will expand on the more popular ones just with a verbal response as well. If we don't get to all of your answers, don't worry. If you don't get to all of your questions, don't worry. We will email you a typed response in the coming days. So I will start off with a question that we had for Carla, and this is on your practical experience. Was there something during your placement that surprised you or that you didn't expect that really kind of took you by surprise and you had to kind of question your experience thus far?
Yeah, sorry, I just wanted to clarify, there's just some people popping up that they're unable to join the audiology breakout room.
That's no worries. My colleague will just go through and assign them. So thank you so much for that.
So things that surprised me, that's a tough question. I think for me personally, I guess working with families, which is something that I've had like little experience with, and I guess people throughout different stages of their life, maybe going into unfavourable health conditions, and being able to, I guess, manage and help deal with that and be an advocate for them. And I guess, in positions where they're not able to help themselves, having to be really there for them. I found that personally quite at times feel a bit emotionally challenging. It was definitely something I didn't have any experience with. So it was quite new to me. But I suppose in all my placements where I've had to deal with that, I've been really heavily supported by both like your peers and I guess the people that you're on placement with being other health professionals and your supervisor. So you do become well equipped to deal with situations like that. But for me, that was probably the greatest challenge.
Perfect. Rebecca, this question's for you, and I'm not sure if you'll be able to answer it fully, but I'll ask regardless. This student is wondering what the health centre is called that you work at. They've always wanted to work in a remote community, and it's something they're very passionate about. So I'm not sure if you're able to share where you work or maybe how you got into that job to help them out if you're not able to.
Yeah, that's fine. I'm hired by the Northern Territory Government, so I'm in a community health centre. We are called the Children's Development Team. If you ever see a position pop up, I think they're going to be advertising for a speechy soon. So if you do want to look into what that position description looks like, you'll be able to find it on the NT government website soon.
Perfect. Thank you for that. Scott, I will direct this question to you. The student is wondering if they can get into the Master of Speech after an undergraduate degree in the Bachelor of Clinical Science at Macquarie.
Thanks, Ella. Look, I'm mindful that there's quite a lot of questions about kind of entry requirements. Perhaps I'll respond to this question first and then maybe speak a bit to entry requirements more generally.
That would be great. Thank you.
So the main sort of barrier for someone with a prior study background like that will likely be successful completion of our prerequisite units. So we have some quite specific prerequisite requirements in the areas of linguistics and psychology. And if you don't have those prerequisite requirements, then you will not have an application that will allow you entry. Students who have completed the Bachelor of Speech and Hearing Sciences at Macquarie or an equivalent degree will meet those requirements. So there shouldn't be any trouble for those students. But I think for you, the person who asked it, I'm sorry, I've forgotten their name. I'm sorry about that. Please feel free to give me an email directly or email the Linguistics Postgraduate Student Office, and we can make a time to talk about your specific background and what you might need to do in order to meet our entry requirements. I noticed there were quite a few questions about how many applications we receive, and there's a reason I haven't been responding to them in the text boxes because it is quite a tricky question to answer. We do receive a high volume of applications, some years kind of up to kind of 200, probably more routinely around sort of the 150 mark. Of those applications, there's going to be a fairly small number who meet all of our entry requirements. And I think year on year, there's probably around 65 applications that I think are really close and in the ballpark. And we do routinely offer sort of around 45 to 40 places. So, there's not too much of a gap between the number of competitive applications and the number of places that we offer. Now, there's been a few questions about WAM as well. So we do have, like audiology, a minimum WAM of 65. This isn't to say that, you know, if you have a WAM below that, it will be impossible for you to enter, but it is the advertised minimum for entry to the course. We do look at every single application individually and try to make an informed choice about the information that's been provided there. So if you have circumstances that are kind of relevant to your application that you want to convey, you can put that into your personal statement, which is basically as Medulla described for audiology. Okay, that might be enough about entry. Was there anything about entry that I missed? Oh, how many of those are going to be Commonwealth supported places? So like audiology, we only have a limited number of Commonwealth supported places. There are 12. Everyone will be considered for a Commonwealth supported place on merit. And if people have equity or other grounds for a Commonwealth supported place, they can indicate that as part of their application. So yeah, unfortunately, a small number of Commonwealth supported places, and they are, you know, very competitive. And in terms of the WAM, we don't know, the calculation isn't done with a high weighting on latter years, although because we are looking at each application individually, we can see that manually. Like if you have performed really, really well at the third year level, for instance, or in sort of later parts of your study, or in, you know, units that we think are really relevant for our course, that is something that we do pay attention to. Oh, with the official transcript or unofficial transcript, if you have an unofficial transcript, you can put that in. However, your offer will be conditional upon successful completion of your degree.
Perfect. Thank you so much for that, Scott. I really appreciate you answering them all in one go, and I'm sure that's answered a lot of the future questions that we'll be getting from students. I will follow it up with this question as well on clinical placements. Are they conducted during the semester breaks as well? I know there's been chat about how intense these courses are, but are there still the traditional semester breaks?
Yes and no. Yes, we do try as much as we can to kind of conform to the regular study session periods of the university, but our second semester units or second session units are a bit bigger than the first session units. They have 2 placements in them, and the second placement in that unit will be in an intersession period. So sometimes that will be in the middle of the year, but often it will be at the end of the year, sometime between the end of session 2 and the beginning of session 1. So yeah, we do try to fit to the university standard schedule as much as we can. And look, maybe this speaks to some of the workload questions as well. I've noticed that a few people have been asking about, you know, what's the workload like? You know, can we, the implication being, can we work alongside the degree? Look, I think it is a big challenge to study full time and try to work alongside that. And, you know, perhaps Carla or Rebecca can speak to that circumstance. But I should also note that in 2021, it's been the first time we've offered a part-time version of the course. So if you do have a job that you're working in now that you really like, that you don't want to give up, or you can't give up, then I'd strongly suggest that you consider taking the course part-time, because yeah, I think the way we've organized that has a really good balance between volume of study and your ability to kind of address other life commitments. Yeah.
Thank you so much for that. Oh, sorry, were you gonna?
I was just going to say, maybe Carla or Rebecca might like to say something about workload.
Yeah, that would be great.
Yeah, I can add to that. I remember sitting in this information night feeling absolutely petrified when Scott said all of this. And they're trying to scare you because it is really difficult, but it is possible to manage everything. Throughout Masters, I worked and I had a volunteer job. And if you are really dedicated, you know, you're not going to ruin your relationships. I didn't lose any friends. You definitely can do it as long as you're dedicated and committed to it. It is possible.
Thank you for that. I really appreciate you being able to provide that little personal experience there. For this next question, Scott, I might direct it to you because I'm sure the experiences differ a little bit depending on the job you do get when you graduate, but is there an average pay of a speech pathologist? This student is quite interested in what they'll be earning after they graduate. does it kind of depend on what sector you go into, private practice, etc.?
Yeah, it really does depend on the sector. And in sort of a public health setting, for instance, you're going to be tied to an award rate. In New South Wales Health, for instance, graduates with a master degree in speech pathology do sort of start a level up from an undergraduate, a new graduate speech pathologist. But look, I can't give you a firm answer there because it is quite variable across industries. I think, as Rebecca was starting to get at, it's a really competitive job market for speech pathologists at the moment, particularly in private practice. Private practice is really, for want of a better way of phrasing it, hoovering people up as they exit their degrees. And yeah, I think because of that competition, new graduate speech pathologists in certain sectors are getting sort of maybe higher than usual pay packets, and not just pay packets too, sort of perks of various sorts, professional development, other kinds of enticements to get you into that workplace. Yeah, Rebecca, you might have something to say about that too, Noria.
Yeah, I disagree with everything you've said. There is a separate award for private and public health, which is something helpful to keep in mind if you're looking at applying for a position in either of those. But your contracts, you can always negotiate your price as well.
Thank you both very much for that. Carla, I might direct this next question to you because you are still studying. This student, wanted to know if there was a society for speech path students or if there's a way that you can kind of connect with the others on campus. I know some people have mentioned that it is quite social. So how have you kind of gone about being social while studying?
Yeah, so for speech, uni offers, I guess, student membership to the Speech Pathology Association, like the governing body. So that's one way, I guess, as a bit of a mentoring and early learning professional development opportunity that you can get on board with. More specific to the uni, we do a mentoring program. So that's where the second year students get a buddy with the first year. So that's something that I participated in as a first year student. So having someone being my mentor, and then also this year having being a mentee to someone in first year as well. So I think, as Helen said, for the audiology, that was really great to be able to have someone that's experienced the course and able to get some advice from them. And then as well, because it is somewhat of a small course, it's just by the nature of being in class and the classroom setup, and I guess the way the classes are run, it is quite social, so it is easy to make friends. And I suppose you're all there and you all have similar interests, even if it's just speech pathology. So I guess it is easy to engage with other people, and it becomes a social aspect from that.
In terms of not getting entry, look, I think the first thing I'd recommend is actually coming and having a chat with me so I can sort of help you understand the reasons a bit further. Like, I don't think there actually is generic advice here. I think it's really important to understand the circumstances of the application. Every cohort is different. It's important for me to be able to understand your circumstances and what your priorities are. And for some people, it might be, actually there's a better place for you to study or a better course for you to study in. For some people, it might be, you do need to show that you can study at the level that we require in the course. So it might be, either further undergraduate or postgraduate study. So yeah, look, there isn't a generic answer. I'd strongly encourage you to be in touch with me. What I suggest that you really avoid is doing nothing and then putting in the same application again next year, because it's very likely to get the same outcome. So yeah, I do have a lot of these conversations, and I'm happy to have these conversations. And, there have been many cases where people have applied 1 year, missed out, and then applied successfully subsequently. So this isn't kind of a, moonshot. This is sort of a real thing that people do. And there are concrete things you can do if you do miss out.
Perfect. Thank you, Scott. And I'm sure students will really kind of take some weight off their shoulders knowing how to go about that if that does happen. A student in the chat is just wanting your email just in case that does happen. They took a screenshot of the slides, but they don't seem to have kept that screenshot. So potentially if you could just pop that into the chat. Thank you very much for that. In the meantime, I will follow it up with another question for you. Sorry, Scott, I know you are busy typing your email. This student has just asked, how has COVID-19 affected the placement? So if students do begin next year and say that we are still suffering somehow from COVID, what kind of things have Macquarie been able to do so students still get placements, but obviously while still being safe?
Yeah, look, it's a really difficult question, and look, Carla might be able to speak to this a little bit. Over the full duration of the course, the sort of standard offering of the course, we have 6 placements, which is a really good number. I'm really pleased that we can deliver 6 placements. Most students in Carla's cohort, so commencing at the beginning of last year, will complete 5 placements. Some of them will complete all 6, but some of them will have completed 5. We did have some sort of emergency measures that we put in place at the beginning of last year when we first had the COVID disruption. So it definitely hasn't been the case that, you know, we've just had to drop placement altogether and, you know, put something else there. We have been able to maintain delivery of the placement program really effectively during this period of time. Now, in saying that, you know, we are experiencing some placement disruption at the moment, but we expect that, you know, as things sort of get back to, you know, the new normal, we will be able to resume those placements very, very soon. And I guess one of the reasons that we're able to do that so effectively is that we do have a really good service on campus in the speech and hearing clinic, which was able to kind of switch to telehealth really quickly. And in fact, was doing telehealth before COVID came up. And we also have the Macquarie University Hospital, which allows us to deliver placements there too. On top of that, we also have some quite strategic partnerships with external placement providers. So, you know, because we do have really good relationships with Royal Rehab, with Royal North Shore, we have been able to, we're kind of first in the line if we aren't able to maintain the placement. And in many cases, we have been able to maintain them. So look, this is another sort of spot where, you know, our smaller cohort is handy. You know, we're not sort of a mega course with, you know, 4.5 million students. We're a sort of a boutique artisan. Look, as I said before, you know, if you are still studying in your undergraduate degree when you apply, that's fine. Your offer, if you receive an offer, will just be a conditional one. So yeah, absolutely fine to, you know, be applying in your last study session. And I think that was the path that both Rebecca and Carla took as well. In terms of the golden time, look, I think that's really up to you. I think for a number of people, you know, their undergraduate study is quite intensive, and they probably do need a little bit of space after that undergraduate degree to kind of regroup and restart. And, you know, it's actually a good idea for them to take a little sojourn elsewhere. And look, I think too, you know, some people, they get into the course and they can feel a little bit flat because they have been in through an intensive study period, and, you know, it feels like they're kind of, you know, back on the treadmill again as they begin the master's course. But look, in saying that, I think the majority of our graduates are people who have come, the majority of people entering the course and graduating from the course are people who have come straight from undergraduate study into the master's program. So I think, you know, it's obviously a successful way to study if you have the appetite for it. And look, the fact that we do have a part-time offering now, I think, you know, maybe changes that advice a little bit. Like, I think, you know, those people who do feel like they need a little bit of a breather, you know, maybe it's a good idea for them to start studying part-time and you know, go up to full-time when they feel ready to do so.
And Carla, I might put it to you as well. Did you have a job while you're studying? And if not, are you kind of happy with the choice that you made? What was your thought process surrounding that?
Yeah, so during majority of last year, I had a job part-time. It wasn't a therapy aid, it was something different, which is, I think, what I enjoyed most, maybe like a little bit of a break from speech pathology. I think I stopped working this year, but I think if you are to have a job, it's really important that your workplace is aware of kind of like where your commitments are, and I guess what your availability will be around, particularly in regards to maybe the end of semester when the workload in regards to assignments gets a little bit more intense, due dates and then placement as well. So I think as Rebecca said before, if you manage your time well and you're dedicated to your studies, it is achievable. But I guess at times like me, sometimes I can procrastinate a little bit too much. It's definitely not the best path to do your studies with. So I've had a bit of both, and having more time on my hands this year, it's been a lot easier. But yeah, it's, I guess, very individual experience.
Perfect. Thank you, all three of you, for your expertise on that subject. I might follow it up with another question for Carla, because you were the most recent to do this. What did you put in your personal statement that needed to accompany your application? Did you make it really personal, or is there any tips that you can give? And maybe we'll get Scott to comment as well on what makes for a successful application.
Yeah, I think similar to what Scott said before, and I don't know, correct me if I'm wrong, Scott, was there something posted on the old website about what to include in the statement?
Yeah, no, there's information. There should be information about the content of the personal.
Yeah.
There, just looking at the website, there is a few little bits of unevenness there now that I'll ensure is corrected. But yeah, sorry, you go on.
So I was just saying, when I wrote my personal statement, I just mainly addressed those questions. I don't know how, honestly, what I put in, but I know it was just addressing, I think there was 4 points that they included, and I just spoke to those ones. Don't know if that helps, but.
Perfect. Thank you for that. And I'm sure students will want a little bit of guidance, so that's absolutely perfect. Scott, I might direct this one to you. With regard to elective subjects, I assume this student is talking about in their undergraduate degree. Are there more appropriate subjects to pick that would better align with speech path, e.g. human biology, anatomy, or anything related to teaching? Or should they keep those elective subjects different to kind of give themselves a mental break?
It's a good question. I might not be the best person to answer this. You might want to have a talk with your program or course director, Anita, perhaps, about some appropriate choices there. Look, provided that you've met all of the prerequisite requirements, I think those electives are meant to be there for your genuine personal interest and choice. So you don't get many choices in the postgraduate course. So make some choices for yourself while you have the opportunity, would be my advice.
Perfect. Thank you for that. And this student is asking, how many hours of class or placement would there be per week during the course? So I think you've touched on how many hours you do placement per week or per semester, but what does kind of a class load of like a general week look like?
Yeah, we usually have classes scheduled on 2 days at the moment. Historically, it's been 3, but we're down to 2. Usually there'll be a morning class and an afternoon class on both of those days. And then the other days of the week will be set aside for potential placements. The class duration will be either 2 or 3 hours. And yeah, the expectation is that you will attend those classes. We do sort of pay attention to who is and isn't around, and we have a really limited time to give you guys a lot of knowledge and information. So it's really important that you're engaging with that. Engaging in every learning experience that's available.
Perfect, thank you. And we are almost towards the end of our questions. So if you do have any more questions just in the last few minutes, do feel free to pop them in the chat. You guys have been asking some great ones, and you can tell that you're super engaged with the presentation, which has been really wonderful. So if you do have any additional ones, please just do pop them in the chat. We have had a few questions regarding dates, closing dates, or when they'd find out if they gain entry. Scott, I'm not sure if you know those dates off the top of your head.
I do. So the applications close at the end of October. And I can see that a few people have asked about, when do we find out about our entry or not? I am mindful that other courses do offer places earlier than us. We're usually evaluating the applications in November. So some people might hear in sort of mid to late November or early December. And that's the first round offers. For second round offers, that's going to be more likely December, January. Look, the reason that we're maybe a little bit slower than other places is that academic staff are involved in the review of these applications, and that is a kind of busy time for us. It's not administrators that review these applications. It's, you know, me and my colleagues who are making decisions about them. I feel like that's a good thing because it means, you know, we get to understand who our incoming cohorts are and make informed decisions about that. But it does mean that, you know, you do need to be a little bit patient sometimes. Yeah, one other question I saw here was, you know, can we use HEX for this degree? So at the postgraduate level, this is known as fee help. And if you're a domestic student or have if you're eligible to be a domestic student, then you are able to use fee help for the course fees if you have a domestic fee paying place or if you have a Commonwealth supported place.
Perfect, thank you. I might just follow it up with another question, again, more on the entry requirement side. This student is currently doing a double degree. Would their WAM that you look at while you do look at it student by student, would that WAM include the marks from both of the degrees and the electives, or just the units that would relate to speech path?
It will include the degree, the whole, everything that she studied. It will be across all of the units, both of the courses.
Perfect. Thank you for that.
I just, you know, gendered that person inappropriately, or they, of course.
Open to all, of course. This student is wondering, are the applicants interviewed, or is it just the written statement in addition to the WAM, of course?
Yeah, just the written statement, no interviews. Again, I'm aware that other places in the Sydney area do interviews. We don't do that for a variety of reasons. Yeah, so no interviews, just personal statement.
Perfect, thank you. And I might direct this to Carla and Rebecca, since you are the more recent graduates and studiers of this course. This student is worried about the anatomy section. It might be quite involved. Do you recommend doing any anatomy courses to prepare you for this, or have you gone okay doing it in the Masters, just maybe with a little bit of additional study? Sorry, Carla, I might go to you first.
Carla's frozen. Oh no, there you go. You're
back. There we
go. Can you hear me?
Yes, that's perfect. Thank you, Carla.
Okay, yeah. No, so I didn't do any additional study. It was just what was provided in the course, and I found that to be quite fine, and I got along with, you know, just doing that well. Obviously, if I suppose you struggle with anatomy, maybe you just require a little bit more study. But no, and again, I didn't have like extensive anatomy previously studied. So, and I managed quite fine. So I think it is doable just with following the course content that's provided.
Perfect, thank you. And Rebecca, did you have a similar experience or a different experience?
Yeah, no, quite similar. I'm not sure if it's changed a bit since I did my anatomy subject, but I didn't do anything else prior. So you should be fine.
Perfect, thank you for that. That does bring us to the end of the time we do have for the questions. Again, if you have any additional questions, you can always find our contact information on the Macquarie website, or of course, Scott has very kindly given us his email, which is scott.barnes@mq.edu.au, and the spelling of his name is just on screen under his icon. So feel free to use either of those options if you do have any further questions, or you can always book a Zoom consult with people at Macquarie to be able to talk to them face-to-face, or as close as we can get to face-to-face at the moment. But I did just want to take a moment to thank all of our panellists for joining us this evening. Rebecca, Carla, Scott, and of course everyone else in the audiology room. You all are very busy and have a lot of different requirements. So we're all, on behalf of Macquarie, we're very thankful that you could join us this evening. And to all of the prospective students, we really hope that this webinar has eased some of the stresses and provided you a little bit of information on a degree that you hopefully are really interested in, and this has just fostered that interest even more. If you are interested, the you need to submit your application by the 31st of October this year if you'd like to be considered for our February intake. So that is just the final due date to be cognizant of, the 31st of October, and we'll send you an email with a recording of this session once we have concluded. So if there were any questions that you feel like you missed out on, or your internet stuffed up during the webinar, you can always watch it back, and that will include our contact details and how to book a one-on-one consultation, and we'll send that through in the next week or so. So we look forward to welcoming you to Macquarie University, hopefully very soon. Have a great rest of your evening, and thanks very much, guys.